She does love having them.
Page 2 of the.
Yeah. So when Lisa had
three.
her,
Exactly. And they're little.
didn't see those, the
Yeah, no.
slides very well.
Only
Yeah, we'll be able to see them better in here, right? Okay.
Yeah, yeah. And they're very,
How does,
the one is she's like, she wants to be on your lap. She wants to be held. And my mom just loves it. Like she'll sit on a recliner, snuggle up next to her. That's nice, you know? Yes, yes. It's perfect that way, that she doesn't have to deal with it day in and day out.
well, cause I could
Because every now and then she'll come over and
slide
how.
or something. Yeah.
That's sweet.
Sure. I don't know, I just couldn't. Yeah. Okay. On this way, what the, okay. Okay, just thanks.
Will we pull up the slides too, we sent, so they can actually see what we.
Laura says.
So it was just hard to see.
Are you joining?
The work. No, what
Right.
the-
You go last.
what the bars,
I wasn't. Everybody's here.
you know what I mean?
Yes.
Like,
I don't know. So what the rate of.
I know.
That's a new one.
I Christine hadn't fallen yet.
I like
Trivia. I like trivia too.
I actually.
Yeah.
Which is fine.
But it's
Just-
usually-
A lot.
It was browser.
I don't know. It was when I pulled it up as
I don't
a
have it.
slideshow. It worked.
They don't have
No.
There were a couple that
And like I don't watch
category like long and
Porter County
stuff
Board of Health.
that
to have like that random.
I probably had to know what it was,
April.
Which is
so we can talk about
Okay,
that.
that's
And
fine.
but the
But you do too. You
hopefully
like all
But
the.
I'd rather be at a
actual tab where you guys will be able to
Ellie's in.
I would
see a little bit better, at least in chart.
Because maybe I was looking at it on my phone, also like on an Apple computer.
All right, let's go.
Uh-huh.
Are we on? Okay, so we're at 5:30. All please stand for the pledge. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation,
under
God,
indivisible.
indivisible, with liberty and justice for all.
All righty, thank you all for joining. Nice to have you back.
Thank you.
Nice to have you back.
Thank you.
Thank you, Colby, for joining us again. So to start, if everyone had a chance to review the minutes, they came by on Monday, I believe, for the March minutes, and if we have a motion to approve, if everyone is,
Just one change.
yeah,
Lisa's name was spelled Lisa instead of
Leesa. Good pickup.
So I just wanted to change the spelling.
Was that you signed?
Yes.
Sorry.
He's not even Mike.
We can do that. So a motion to approve with that amendment? Can we entertain a motion?
I move to approve minutes.
I'll second.
Okay, Dr. Boston,
Yes?
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes. That way.
Kathy,
Can I share with you?
Yeah. Although I wasn't here.
Dr. Osan,
Yes.
Terry.
Yes.
Thank you, everyone.
Thank you. Our next board meeting is scheduled for May 7th, which is Election Day. At this point in time, I'm going to keep us on the books. We do have our health officer position open now. If something were to happen and we start getting applications that we need to review, if we as a board will have to have executive meetings, hold interviews or things of that nature between now and that meeting, I may cancel that meeting just to lighten our load if we have more things to attend to between now and then. So as of right now, we don't. So I'm going to keep things on the docket as planned, but if things change between now and then, I may contact everybody to change things up.
Okay.
All right. Any new business? Old business? Any report that you have to pass along, Colby, for board attorney?
We reviewed a significant amount of contracts related to the previous meeting. In the last 30 or so days, if you recall, there was MOU with Balin's office. That has been reviewed and passed along and approved. There is materials for the bike program that we were able to look at, both the contractor for maintenance purposes, Leo's Bike Shop, which that was an acceptable contract. We also had a release and waiver for the actual participants in the program. That was approved. There was a free bike application process that was also approved. There were a couple of different things that we were working on. We'll circulate that for the application process. But I didn't know if actually that's not live yet, or is it live? Okay, so it is live.
Yeah, I did. I looked it up.
So that was also approved in the last 30 days. Another MOU with the Portage Township YMCA and the Health Department. That's a general MOU contract without no specific obligations with regard to it. So that was also approved. General administration with regard to the Health Department and a couple of different things administratively with Bluebeam. And then you probably don't know about this one already,
Oh,
but
surprised me.
the dental fair affiliation agreement was approved, and you don't know because I only did it an hour
Oh,
ago.
well done.
But I looked over that draft, and because they circulated basically a contract that is a affiliate agreement, multiple year type of agreement,
Oh,
and we need it for
One time.
day. So, I mean, essentially, they left blanks in the term, and that was probably significant. I mean, that's good enough to fix any kind of issues.
very good.
So if I
We kept-
covered the amount of contracts that we took a look at over the last 30 days.
Sounds like you kept them, yeah. Well, this
Yeah.
is, well, that we're kind of in an exciting time where we're creating these new programs and developing these new programs. So up front, I think it's going to take a lot of work with our attorneys to get all of that underway. And hopefully, going forward, it won't be as much to do with these types of things. Thank you. We appreciate you.
Yeah, that's the end of the legal report.
Okay, well, that was good. Very good. Claims and receipts, did it make its way all the way around?
Yes.
And if we have a motion to approve claims and receipts, please?
I'll make a motion to approve claims.
Thank you.
Second.
I'll second.
Okay, Dr. Bob,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Kathy,
Yes.
Dr. Osan,
Yes.
Terry.
Yes.
Thank you.
Thank you. All right, so report of committee staff and health officer in your order of choosing.
Sorry, I promised Demetrius I would turn this on.
You've been busy.
So I will share, last week, try to figure out what order I'm pulling things up in. We had shown the new template for how the cause of death information is being categorized. And so this is the PDF form that you guys receive in your report for the monthly cause of death. And from that, Lisa, Leesa. And I felt terrible because I reviewed this.
So did I.
Put together this PowerPoint, but I know that depending on how you were looking at it, it may have been difficult to view. So we can go through here. But what I also wanted to say was that we can send the original document, actually an entire spreadsheet. So this is what you received, saved as a PDF. But if you go to sheet number 2, it gives all this information, and this is where she generates the graph. So if you guys would like us to send this whole Excel file protected instead of that saved PDF, that'd be helpful.
I asked for that. I communicated that with her, and I really love this sheet too. It kind of falls upon our last meeting where we asked if there was a cause, like for instance, I believe there was like mental at 21. If like the threshold was 15, can you give us a further breakdown as to what those are, the neoplasms? And so that sheet 2 and those color graphs really, I think, is more beneficial and more helpful in terms of giving us data that we can extrapolate from and seeing how many lung cancer deaths versus GI deaths versus, you know, those types of things and what the mental disorders were and things of that nature. So for me, I would very much appreciate to continue getting that sheet 2 in that form. It's more helpful to me in that layout than the bar graph.
Okay.
Bar graph was really sort of smooshed.
It was, yeah, smush,
Okay.
so it's hard to read the line, yeah, what the categories are.
Okay. So if Lisa does it like this,
This is
Yeah,
great.
so
yeah.
we wouldn't need the PowerPoint at all? Does anybody?
I like the total tally of how you guys always keep it, but I think, you know, if we are, I think we're obliged to be a little more detailed in terms of what the causes are, and those that are above 15 to have that kind of break, just like how she did on that sheet too, I think is necessary, to be honest. That's my opinion.
Yeah, because I couldn't see it in the PowerPoint form because it was like smushed together on the
Yes.
bottom.
Okay.
So I couldn't read any of the differentiation of the categories. So this is really, what you had just pulled up
Okay.
was really great. Because then I can see under the mental disorders, 21 were dementia. Whereas on the other one, it was smushed together. I couldn't see that line.
Okay. So what I can do is I can send that to everyone right after. I didn't want to bombard your email with yet another email after we had the discussion, so I thought we would talk about it now and then we can fix it going forward. So we can send you all that document of the protected Excel, and that sheet 2 is where all the details are.
Yeah, I very much appreciate
Okay.
that. It was very well done in that breakdown.
Wonderful.
Can you pull the,
Yes,
can you pull the spreadsheet up again?
Uh-huh.
Just so that is really exactly what she got pulled for the PowerPoint, and it is the top 4 causes of death.
Yeah, I think
So
we said
which
any that have
really-
over 15.
The breakdown is such, at least the past couple months, really such that those top 4, the neoplasms, respiratory, circulatory, and mental, are the only 4 that are even close. So keeping those tabs on those 4, and then of course if there's anything outlier that like it's changing or whatever.
Okay.
You know, for instance, there were 7 digestive system this month, where there were only 3 last month. So, I mean, that's one of those things maybe just keep an eye on if it continues to climb. I doubt it will, but you never know.
Right.
Can I just ask about line item number 18, the circulatory system, when they talk about other forms?
Sure.
There's a significant number.
Right.
And I would expect I would be able to look at this and pull apart.
Right. So, according to the ICD-10, other forms of heart disease includes CHF. So it includes any cardiomyopathy and valvular heart disease. So it's a fairly significant size category for to be put under circulatory. And so we're going to see that being a fairly high number, and that is exactly right. It's almost all heart failure
Sure,
with some valvular disease
that makes sense.
put in there.
Thank you.
Are there any other questions about, because some of them are, especially some of them are
Is
a little
there a way to
confusing.
tease it out? Let's say, for example, I'm just going to give a very off-the-wall example. Let's say we had a bunch of 20-year-olds that died of heart failure specifically because of cardiomyopathy, for example. Is there any way for that potentially to be teased out? Because there's one thing to have
Well, look at,
that's
look,
I think the first,
extrapolate that out. They put them in each age.
I think the first thing would be to notice that there's all of a sudden a bunch in the younger
Right.
age, right?
Right.
So it's nice to be able to look through this and say, really, we've had 1 death this month under the age of 50.
okay.
I mean, well, I don't know that
Yeah.
completely, but in these 4 categories, that's the case, which is definitely something that would
Alert.
pique our attention.
Yeah.
So yes, absolutely, that is something to be looking at.
Yeah, I don't know if you could see as it goes along, it separates them out per decade so that we can point that out.
Perfect.
Scary.
Yeah,
I like it,
No, thank you, I like
Yeah.
it.
really helpful.
very much so. It's important.
That, so then that'll be, then we can protect that
Yeah,
book
yeah.
and send that
Yeah.
right along. So
And if you all see something that is like, what on earth was this one?
Yeah.
If you see something that looks strange, let us know. If it's one case, if it's one patient, you should probably ask us and we'll get you that information because we don't want to, expose anybody.
Yeah,
Yeah.
no one wants to see their family member on this list.
Oh,
Right.
Okay.
Very good.
thanks.
So
Thank you.
Thank you.
Excellent.
I will just give some health first updates. I'm going to start with, we'll start with the Find Help button. So we have some things going on here. We search our zip code. We have programs that are noted as network members. So you can see that here. And the next stage is that now they're in the middle of identifying network affiliates. And so those will be people that partner closely with network members that also are trusted providers. So that means that if they're an affiliate, we are partners with them. We know that their response time is good and that their information is up to date, things like that. So they are in the middle of putting all of that in place. We also have, and it has been going around on the slideshow, a QR code for the Find Help button. So a press release has been written, the QR code has been generated, the flyer is being prepared, and we just want to get some of those network affiliates up. SAMP has requested that some of those be identified before we release the press release, but we are very close. So just kind of wanted to let you know about that. And then, of course, we will send you the flyer as well to be promoted, and we'll be promoting it on socials. Did anybody have any questions about that? I know those are some of the things we've talked about related to Find Help. So then if we go into Health First Indiana, we'll just go through here and do some of the updates from the strategic plan. So on Tuesday last week, the county council did approve the health officer new expanded job description and the pay rate. And so we did post that on 3/27. So we are accepting applications. If you've been able to share as well to spread the word. So we have that posted. Just to go through for our health fair, I believe everybody received a flyer. And if you would like additional flyers printed to circulate or a poster size, let us know, because we definitely facilitate that. We have over 40 vendors who are coming. So we did recently, we will be signing an affiliation agreement with the IU School of Dentistry, who's going to come and do dental screenings. We have vision screenings, haircuts. We'll be giving sports physicals. We have the cardiac screenings, vision and hearing, as well as a lot of different organizations that are just going to have activities, information about how to get involved in the different things that they do, games, a DJ. It will be a lot of fun. So we're very excited. So definitely spread the word about that.
Can we have the schools put those flyers out or hand them out to parents?
Yes,
Yeah.
yes. Yes, so we'll be delivering for
By the end of the year,
also
school year.
going out on their emails, so.
Good.
As far as our promotional video, we shot that on the 28th, and we had received a rough cut. And then today we received the rough cut of a small snippet and the featurettes as well. So once we do some editing on there, we've got some name things. There are a couple things on there, and we get the sound and the picture polished up on those. We will have those for promotion, and we'll share them with you as well. So we're excited, and of course we'll have them on our website. Jess and I had a meeting at the end of last week, Thursday, with a company regarding the public health vending machines, and we were very excited when we got off the meeting. So the idea is we budgeted from Health First Indiana to put 2 machines in place this year, and then and to stock them. And so then the idea is that going forward, we would add vending machines so that we get them in different areas all around the county. So the plan was to start with Valparaiso and Portage. And so they're custom made for whatever it is that you want to put in them. They're temperature controlled, they're Wi-Fi connected. So we just need to send one of each product that we want to put in, and then they custom make it for each of the
Oh, wow.
items. So we are very excited about that. So right now we're making a list, and then we'll be pricing and figuring out how we're going to do that and ordering so that we can get those things to them. And we can get started on that. So we were very pleasantly surprised. They brand it. They put your logo on the front of the machine. And so yeah,
Very good.
we were very, very pleased.
What are you guys going to be putting in the machines? Do you have like an idea or a focus?
Yes, so we have done sort of like a needs assessment for different populations. And so socks is a big need. Of course, we'll be having hygiene supplies in there. We'll have Narcan in there, condoms. We're going to do pregnancy tests. What else am I missing?
It's really about it so far that we discussed.
Yeah, so we'll definitely make an exhaustive list and make sure.
And then I'm just asking because I'm curious, like, how does it work? Is it like free to pull the items out, or do you have to give information to pull the items out, or?
So it does track metrics. So we have choices. People can sign up to get their own code, and that's something that we'll have to decide. And then there also can be a general code that just anyone can have. But it is controlled in the fact that somebody can't come and clean out the machine. So that was one of the things that we were wondering about.
We can limit the supply so they can only get one of a thing or 2, dependent. So they're not just like taking the whole row of deodorant, for instance.
Gotcha.
Yeah, because those were a lot of the questions that we have. You know, it's one of those things where you don't want there to be any barriers to something that somebody needs, but at the same time, you don't want somebody to be playing around and taking away something that somebody could need. So that was, you know.
Is the machine going to be recording?
Yes. Yeah. And then, of course, it tracks metrics for what people take by, you know, whether it's the generic number or if somebody's assigned one, so.
And then are people notified and aware that they're being videoed or tracked?
You know, I would assume, I bet that probably has to be on there, but we
We
can
would
find out about that because that's a
have us,
Because it's
think-
very
Yeah,
a little
that
bit,
would
right?
be a little
I
bit of a
know.
barrier, like, realize you are being,
Yeah.
right.
videoed. I mean, on the one hand, it would probably prevent a lot of vandalism, but on the other hand,
Exactly.
we want to make sure we're protecting people's privacy
Mhm.
too. So I can see like how you said that would be
Mhm.
both considerations.
Yes. Yeah, thank you. That's something to look into. I know that it notifies us when things are getting low and things like that as well, so.
And where are they located?
So that is, we were thinking, New Hope Church, or
Living Hope.
Oh, I said the wrong thing, on Calumet. And then we also have spoken with the Portage Y in Portage. We're not sure. We also talked about possibly the Portage Goodwill, which is right there in that same, trying to be centrally located, and in areas, where people can access them and get what they need.
I just want to make a quick comment. So this year at the Indiana State Medical Association, I was down there for the meeting, and they put up Narcan dispensaries, mostly through Indianapolis, but they had a few Narcan dispensaries throughout the state. And there were some locations where those machines, those vending machines, were basically within 24 hours completely emptied out. And then the question was it legitimately emptied out or not? So I know that you guys are thinking about it, but I just kind of want.
What's the harm?
Well,
I mean,
because
let them take them.
well, fair enough. I don't disagree with you. Let them take them, but I mean, are the right people getting them, right? I mean, is it just people going up to the machine and just stealing them and selling them, or are the people that are needing them actually getting them? And that's the issue that was kind of debated at the Indiana State Medical Association. I'm not saying it's right or wrong.
Well, if we make them more available, then there won't be a need for people to sell them, right? So people won't have to go buy them off people if they can get them.
Is there a way to monitor it?
I mean, you put up deodorant for free, people will steal it till they're blue in the face. At the end of the day, you give away something for free, people will take it even if they don't need it. I mean, God, there was a toilet paper run during COVID, and COVID didn't even cause diarrhea. So at the end, and before paying for it. So I mean, at the end of the day, people always take what they can get for free.
Did they talk?
Did they have
about
suggestions at the
monitoring?
IS?
Yeah, so there was a lot of back and forth debate about that. Unfortunately, it wasn't resolved, and we have a working group that's looking into how we're gonna be able to monitor that. So we don't have an answer to it yet, but nonetheless, this was an issue that we had at the state level for the Indiana State Medical Association.
So maybe choosing the location will help balance that
Or
luxury and liberty.
yeah, and like Jess said, she did, of course, give us examples of locations where they're using them, and none of them are. And you know what great success they're having, and that they are getting them at alternate locations. She gave us some information on how they're using it. You can limit, you know, how much is taken at once. I, of course, don't know how that would prevent somebody. You know, I don't know how
Coming back.
you could come up next. So those are all questions that we can ask.
It's a difficult question,
It is.
Yeah.
and I know it's a difficult question.
Yeah.
I'm lodging it.
And I think it would also be difficult to know, given that, how to budget. I mean, because if you're trying to say, you know, we're going to
Right.
sustain this in a way
Right.
that is helpful, but not also just giving, you know, like, how do you budget for
Right.
this? Like, do we give a, are we, you know, I guess you'd have to see, are we giving
Right.
away 300 sticks of deodorant a month or 10?
Right.
You know, and then what budget does that come from?
Yes.
You know,
I mean, we have it budgeted.
Right, exactly, but I'm just
Yeah,
saying, like,
exactly.
it's sort of a hard thing to predict until we do it, right?
Yes, and it's also hard to predict how much of what to put in there, you know,
Yeah.
as we get started, and that's kind of why we went to host and asked a lot of questions
Right.
about needs and have a list, and, you know, we kind of know, you know, the number one thing, and those
Mm-hmm.
sorts of things, and so we can go from there.
Well, and I think then if it runs out, it runs out. You know, I think then we get data from that and then see if we need to change that a few months later. But that it is what it is. You know, we put this certain amount, it runs out, it runs out. If people abuse it, then they have to answer to each other.
That's
You
why I
know?
think location will be important because it'll create community sense of responsibility.
Right.
If you're around and you know this guy's inappropriately taking things, let's kind of manage him so that there are things for the other people that.
Right.
So maybe location in a way where, you know, you always have faith in your humanity and community, but we all know human nature. So you try to create where it's in a location where there would be that accountability. Try to create that for all of us. Unless they have Twinkies.
Sorry, I have another question. I'm like,
Of course, thank you.
are these being bought or are we renting these? And then how long is the lease for these? Bought, okay.
Yes. Sorry, I was pulling up the amount. Yes. So they are, so an outdoor machine, it's completely temperature controlled with the custom configuration and branding. So that's exactly what we want to put in it, configured for us with the branding on it, delivered and installed is $10,700, which was really good compared to just the general quotes that I got when shopping around and talking to others who would use them. And then there is some software, a yearly software fee of $600, just because it does keep all the metrics and notifies you. And then we would get a cellular, there's also a cellular fee for the Wi-Fi. So unless you can hardwire it to Wi-Fi, then you have a cellular fee. We discussed some options for potentially hardwiring it to Wi-Fi, but I really feel like to go cellular, we
It's our control then.
have that connection.
Yeah.
And where is the information stored?
So it would be stored on
Probably a cloud. Yeah.
cloud-based.
Cloud-based.
I'm gonna say
It's
I'm
cellular.
just wondering,
Yeah.
like, you know, if we're storing visual, like, you know, for videotaping people, or people are accessing it, is that information stored?
fact, it may not be videotaped. She just was telling us we would be notified real time if it was empty, if something was empty. I don't think it has videotape and I misspoke. We'll confirm that. But I
Generally, you
think that
can't
was wrong.
have more than 24 hours stored of videotape for those security things.
I would imagine the cost of that would be
Yeah, that's what
high.
I was just wondering, like, how,
If you're gonna be asking them one more question, about like general theft from the machine.
yeah.
Can it just be yanked out of the ground and taken off on the back of a pickup truck? I mean, like, what's the security on it?
Water guns.
I mean, they take ATMs. I mean, honest to God.
Oh, no, I mean, if there's a will, there's a way, I guess.
Absolutely.
Yeah.
You got stuff
Take all the
for
tampons.
free, nobody watching it.
Okay, thank you. Does anybody have anything else? This is good. It helps us
Yeah,
think about things.
I like it.
Yes.
Reality.
From order, what is the time frame of when we'd be able to receive those? How quickly would they come? In my mind, I'm thinking before like next winter for that
Yeah.
living hope, to have that there with the socks. But if
You know what? She
sooner,
said
even better.
that the next step would be to send one of each thing. So, yeah.
So a lot of these items are currently being dispensed at Living Hope. When we were there for the dinner
Sure,
on
yeah.
Friday, the table is full of all these items, and folks, when I was there, seemed to be taking what they needed, So even though there was some oversight, you'd like to think you were saying, Dr. Fleming, about, there's some accountability for others, kind of just checking it out, right? Sort of watching. So I know that machine is a standalone, and people might think they're alone and might think differently, but I don't know. I think to the points
No,
made,
just,
I like to
yeah.
think that is a community in need, and that they share that same accountability and responsibility to each other. So that would be my hope, because it works well there.
Yeah,
It's
very
just
well.
laid out on a table and in boxes, and people come through and take what they need.
Yeah.
And she did give us examples of municipalities where the health department is utilizing them, but we could always reach out, ask for their contact as well. Contact us to reach out to talk about challenges that they've had, ask all these questions.
It's
How they overcome those things. That's absolutely something that
when we lived abroad, helping serve communities that are very indigent and underserved, you learned real quickly that tough times, people look at things differently when you got everything in front of you. So you try to understand it, you make sure there's a,
Right. And the flip,
to them, it's like,
And-
this is an opportunity.
right.
So it's just, you put it in a setting, you can help them appreciate the value of it, human nature without being guarded. Well, just naturally, I mean, if you put Oreo cookies in a corner and I find them, they're mine.
Right.
I mean, and I think location, answering some of these questions, it's just a wonderful thing to have for those that need, but as in most cultures, 10% don't always find.
So let me switch it to the opposite side of the house. How are people to know that this is there? I mean, and we got Porter County Help, but then again, this is an awesome resource. How do people that need those things know that that resource is available too? So that's the other side of this.
Location and help.
Yeah.
Help.
A little bit about-
I think word of mouth will be huge.
Yeah.
For something like this with community, I think word of mouth will be.
It's a really unique opportunity. Hopefully it works.
Well, there's also, I mean, we've been kind of working with the Facebook groups and the Porter County Neighbors Helping Neighbors and, those kind of things. Those tend to help word get around kind of remarkably fast on that Facebook
Yeah.
group. And I think there are a couple other ones.
And a need.
If you don't mind, I think I will start a discussion just really, so a public health vending machine, we talk about some very basic things being in there. There are other things that can go in a public health vending machine. So, and I'm kind of just talking about options. Fentanyl and xylazine test strips are possibilities to put in a vending machine like this.
Yep.
from the videos and the discussions they're having, some agencies put cookers in there, so to cook the heroin, to melt it down before people inject it, those kind of things. We do not have a syringe, like syringes cannot go in there, so that's something that is off the table for now, right? I mean, I think I'm understanding that correctly. But, as far as people who are using drugs, there are some harm reduction things that can be put in there, and I think that's something, a discussion to start what we, how far we kind of want to go with harm reduction with these vending machines and where to kind of go from there. And those are kind of some things that maybe it's, if we have one in Portage and we have one in Valparaiso, those might also be things to have those discussions with the municipalities also. If we are going kind of over, the basic deodorant, condoms kind of
Harm
level of,
Yeah.
of harm reduction.
Yeah, I honestly think that something like that would have to go to the voters, the people of the community, whether or not they want those things in there. So we'd have to include that.
The challenge.
Yeah,
I'd-
it is, but
Yeah.
then again, you can't make a unilateral decision without having the people of the community agreeing that those.
Yeah, I don't know how that works, what's required for referendums, those kind of things, I don't know. Yeah.
We are allowed to do those strips, right? We've had this discussion before.
Right. The fentanyl and xylazine test strips we actually have some of those to distribute, but those I don't think are really as much of an issue as things like
crack
how.
pipe in there.
Right.
Right.
Right, yes,
Those are very different sides of the house.
right.
I think the test strips are interesting because we keep hearing more of these laced
Yes.
fentanyls that are laced with the xylazine that's refractive to Narcan. You would hope that people would worry about that and check to see. I don't know. I don't know.
Okay.
Could we change things in the winter versus summer?
Sure.
Like when you say that they're kind of,
Fit.
in the winter months have more warm weather, supplies, gloves, hats, things of that nature.
I bet we could work that so we could send, this is what we're thinking for winter and summer, and then they could kind of let us know, well, then these things need to go in these locations and, that kind of thing. I bet we could do that. Yeah. We can figure out what would be like sized and
Yeah.
what we're thinking. and-
Oh.
Yeah. Absolutely. Yeah, and we'll follow up on all the other
Yeah,
items as well.
the discussion continues.
Yes, thank you.
Very good.
Great idea.
Mm-hmm.
I believe we talked last week that the diapers, wipes, and sanitary napkins had been, or last month, I apologize, delivered to all of the pantries. We actually had one pantry that had taken a pretty small amount, and they found that they have,
More neat.
now that they have them, more need than they thought that they had. So that's really nice because, they hadn't offered before, and so they weren't quite sure. And so we've kind of talked with them about that now that people know that they have it and they know that there's a need in their community, kind of how we'll size that. And so we also have a small food pantry in the office, just that we are advertising in the waiting room and in clinic rooms, just in case there's a need for somebody that's immediate to get by. And so we have had a couple of people who have visited that pantry. And so that was actually Lisa's idea. And so it's called Lisa's Pantry. And it's been a very nice addition. So we've kind of rearranged things down there and kind of gotten it into an area that's a little bit more private. And there are diapers and wipes and sanitary napkins in there as well. And then we will go to the other part of the website to look at the posting for the bicycle program. So we do have some bicycle applications that have been approved. And I believe they were going to be ready today, but because of the rain, the delivery will be later this week. Our partnership with the Portage YMCA that was approved, that 30-day posting period is up, and that has been signed. So we are excited to begin working with them and to start getting data from their programs. And then the partnership from the sheriff's department, the 30 days will be next Monday. It will actually be over the weekend, and so we'll be able to sign that MOU that was reviewed and get that partnership going. And we also posted a request for proposals from retail food establishments regarding menu items that they would like to have approved for a Heart Healthy or a Heart Health First Indiana program. It will be a little sticker that they'll be able to put on their menu to note that that meets the American Heart Association's Heart Healthy
You have gotten response
requirements.
from this?
We've had a
Good.
couple, so we may, of course, we want to make sure that we have responses in all different areas of the county, and so we might reach out to people and say, hey, would you be interested in submitting some menu items, just so that we make sure that, you know, there are restaurants all over represented for people. And the idea behind that is there will be healthy menu items to choose from. Of course, we will be able to advertise those and encourage people to look for those things on the menu. We also would like to have encourage some senior gatherings around those. And so if those establishments will offer a senior discount on those items, then we would be able to work together the difference between the menu price and the senior discount to reimburse them for that. Kind of an encouragement to get senior population out and together and togetherness. And hopefully we will receive a proposal from Purdue Extension as well that will kind of go along with some evidence-based programming around the heart healthy eating as well that we can kind of promote in the same program. And they also have a well balance, so like some exercises for balance and things like that. Kind of complements what the Portage YMCA is doing up in Portage, kind of similar things down in this area of the county. So that is for that. I will go back. I did just want to show that we are adding to our community partners page. So here we're just doing flyers that list the partnerships, and then these are what we share with Indiana Department of Health as well. So we send them down to their public relations individual, and they rotate through different health departments for success stories. So that covers those, and then you've seen this one before. This has actually been featured and is still on the Health First Indiana, the state site, as far as a success story, our transportation flyer. And so we just will continue to update these. There are some more that we have to make as well. So those are on there.
Carrie, in terms of the bikes, did we come together with something to put on the bikes?
We absolutely did. Yes, they have been ordered, and they're an asset tag. They're made for bikes with a barcode and a numbering system. And then it just says, if found, please call, and it has our phone number on it.
So there's some tracking in case something were to happen.
Anything else I'm forgetting about that, Chris?
With the bike program, are there helmets?
There are. Yeah, so we'll skip down to here. This is the flyer for the bicycle program. So we have distributed these at the library. But on Facebook, Carrie? Last Friday. 2 Fridays ago, yeah. So we did go to host and to the library with posters and to drop off flyers. And we've got some word out. It's one of those how fast you start when you start something. Right. Of course, we want word to get out there, but to kind of get your underneath you and get those first in and see any. The application is posted right under there. And along with the bike, everyone gets a lock and a helmet and a basket to transport things. There's also a liability release form. And there's bike education. So, they go through the application with Carrie. Once they're approved, then once the bike's in, then she goes through bicycle safety and education with them. And they receive those items and the bicycle. So there's data that we collect simply for fitting. And then there's, some items that are they don't have to answer the they would be for demographic gathering, and so we put all those things in the application appropriately.
I apologize for jumping in, but
Oh,
as far as criteria as to who can be part of the program, I mean, proving that you have a certain income and that you don't have a bike at home, like, what are we gonna do? Go to their house and like search their garage to make sure they don't have a bike? Like, how?
Honor system.
Right. I mean, honestly, it's an honor system, so I don't know why the criteria would even be there in the first place. I just don't, it seems a little.
Maybe as a reference for them.
We have to start somewhere.
Okay, I do have a bike, why am I?
Yeah, why am I?
Maybe.
Yeah, because
Fair
the
enough.
program is, it's made to fill a transportation. Just, we know that transportation is a need. We aren't able, of course, to put in a busing line or anything
Right,
like
that was the number one thing that
I'm-
came from our needs assessment, right? So how,
Honestly, it'd be nice to have like, rentable scooters and bikes in town. I mean, that's a
We
whole
do,
other discussion.
right? Don't we have those?
They do
Do we
Rentable
have them? I don't see them like
Yeah.
I see them in the big cities, because I mean.
I think you have to have a credit card, right? Is that what we were,
So-
we were discussing that, because that's
Yeah.
a limitation.
Right.
That was the
right?
barrier, is that
Yeah,
the
the
barrier.
Divvy
barrier.
bikes
Yeah.
or whatever they are in Valpo require a credit card
Yeah.
to use.
I mean, I'd rather give people that are in need a card to access that for free than have the separate system, but that's a whole nother conversation.
Yeah, it was a nice, I think it's a great gap for, when we did that needs assessment, that it comes up that transportation is the number one need. It's hard for us at the health department to fill that gap, so I think this is a nice place to start to be able to address that issue. Especially with these young people, so many people can't afford to insure a vehicle, they can't afford to insure a young adult. I have two of them.
I don't
They're very
disagree,
expensive.
but, I mean, we're so rural that hell, I need a bike just to get to my neighbor's house. So at the end of the day, like, I mean, biking is probably the lesser of the needs. The Lyft program sounds to be.
I think it depends on where you are in Porter County. That's the
Sure.
thing. I mean, I think in Valpo and Portage, I think a bike is very helpful.
exercise.
Yeah, and on top, exactly, and then on top of that, we promote the exercise.
Fair enough.
as well.
Would there be any way in the vending machine to have an option of a card for like a Lyft and Uber
Yeah.
or a Divvy or you put that in the vending machine? I mean, I don't know.
No.
If we're trying to,
Yeah, we can look at
Me-
that. And actually, one of the calls is, well, I know that there are V-Line vouchers as well.
yes,
of
that's what I was
course.
gonna say, like,
That-
because if we're trying to link it with this is awesome. We want to encourage people to use this, but like you said, if I need to drive somewhere and take a bunch of groceries with me, I may
A
not
doctor's appointment.
right or something, and if
Right.
there's a lift like for a $10 ride or something like that, now again we'd have to
No,
we
do
don't want
have
We
a
have-
lift program as
Right,
well.
the Lyft
Yeah.
program is in place also.
Yeah.
But how we bridge the gap, I think
Right.
that's what I keep finding over and over again. We're very blessed in this county. We have many things available to us. How we get the person from point A to point B
Exactly.
seems to be the challenge.
And what's the protocol for the LIFT program? Like, how are we initiating that?
They contact our care coordinator.
Yeah, they contact Carrie, and so that's a referral, and it does have to be, so she has gotten, it has to be, they have to have no other transportation.
Can you pull up that sheet with the transportation
Of course.
with the bicycle at the bottom is a lift?
Yeah.
Yeah, I saw, I just haven't.
Yeah, there is.
Like I know some of the, like the Portage Recovery, their cafe, they offer this Lyft they want to try to offer this Lyft service to offer people a ride, and things so it's the same type of mentality, I think. But how we get people to know that it exists and get asked for the help is,
I had
Gonna be
a
the
patient about a month ago that thankfully through his insurance, because he did not have transportation and I needed to admit him to the hospital and not enough where he needed an ambulance. And we spent an hour where he would try and I would speak to them to just get somebody from Lyft or Uber to come and get him. And this would have saved me a lot of time.
well, and I had a
It's
patient,
nice.
it took me 2 weeks to get that coordinated because she was in a horrible motor vehicle accident, she needed assistance.
yes.
And the only thing the insurance would pay for would be an ambulance ride, which she
It
didn't want.
surprised me that
I mean,
or the Uber,
No, it's ridiculous.
It's ridiculous.
It is.
Absolutely is.
but that's great.
yeah, this is nice.
This is a very good option.
Yeah, and Carrie has been very busy getting
Yeah.
programs up and helping with organizing all this. We are going to get to the point where we will be advertising her services out to everyone. It's been one of those, now there's
Yeah.
word of mouth and
Yeah.
these things, and we're doing these things, and she is getting a lot of calls as they come in. We will
Good
be
for you.
advertising her and get the information out to providers and things like that. But right now, we just needed to tiptoe into the
Yeah, no, it's good. I'm proud of you. You're very good.
Do you have any questions about any of that? I think that's everything.
That'd be awesome, especially for some,
Just trying to make sure I didn't forget any.
Oh,
the ones that are always, because they're always relying on family members to
so
give
they
them
get
rides.
the bus,
You want to do the task force? I think that's a good one too.
40 minutes.
Right.
On
behind.
the youth task force
Absolutely,
that we're partnering with to go to the schools.
absolutely.
Yes.
That would be amazing.
And,
Well, I just saw that he has a name now and
oh, yes.
Believe it when I see it.
Yes.
Here, call these.
So another thing that we are up to is a joint task force with the Tobacco Education and Prevention Coalition for Porter County, the Hub, which are our Substance Abuse Council, the Positive Approach to Teen Health, the Health Department, and the Juvenile Justice System. And so we're just kind of working together. We formed a task force, and in the report it has a name now, the Adolescent Supports and Knowledge Initiative, ASK. And the idea is to work together to come up with a program to present to the schools, which would have some restorative policy options for them, and then also programming to provide preventative education and support programs, and then also some of the like deferral programs for instances of substance use. So we're really working hard to devise something that would be consistent across the county and that would be positive for students, for faculty and staff of the schools, and for the whole community to, of course, address substance use, attendance in school, mental health.
yeah, the mental health I think is
All
that we finally have a way to parlay that
Then
in.
support.
Yeah.
Then that
Yeah.
support and the staff knows who to talk to help give a kid direction.
Right.
Then you reduce the illicit drug use, you reduce the absences, you provide, and so it's that support. That's why I love this so much. It just offers an opportunity that really wasn't there. So
And we really
that-
are excited, and we
where the
hope,
rest comes from it.
everyone will be excited as well. And it's very, very early stages.
I know, I'm expecting a lot.
We're-
Well, I'll see it, I want to see it.
We're very early stages, and we've been meeting as a task force, and now we're beginning to pull in stakeholders one at a time to put those other pieces in place, because of course we do need to know what else is out there and is currently going on, so that we're using all of those pieces and making it one program.
I need to say, I used to do the Porter County Fair 23 years ago. I did that a few times, and then I take the new ones down. And in 23 years, we have never had opportunity, and all the work you guys are doing,
It's amazing.
this is amazing. So when you're ready to go, okay, let's go, I'm done. Just keep it up, because we have not had access like this. And it's just good to see that finally technology can bring something good,
No.
instead of, so I just thank you. I realize it's quite a bit of effort. So thank you.
Do you think this could possibly, and I know I might be speaking out of something you may be able to answer, like when the new school year starts?
That would be awesome.
Yeah.
No. I think it, yeah.
Step at a time.
Not yet.
Yeah.
We hope so. Okay. I mean, that's
That's
exciting.
It's so hard because I feel like it was Christmas
it's-
talking about it.
Yes, I remember. Yeah.
But now
Yeah.
we're past
It
break.
does, you
It's gonna be
feel-
summer.
I
And,
see
yeah.
these-
So, yeah.
wonderful.
Yeah.
Anyway,
Um,
thank you.
I did want to. It is Public Health Week this week.
Yes.
So I kind of missed the boat yesterday, and I apologize. But public health is preventative health, so oftentimes it kind of skates underneath the radar because we're out doing all the things that nobody knows about unless something goes wrong, like a foodborne illness or another epi incident. So we kind of talked today about how really the pandemic shone a light on public health, and now with Health First Indiana, we get that new light shown, so we're having the opportunity to do all these amazing things. And so in the office, we are going to spend the next 3 days highlighting different departments. So we'll do that in the mornings, and then on Friday, we're going to have a breakfast all together. So it's kind of
Good.
to let you guys know about that. And Demetrius has got a toolkit, so he's going to be putting things on social media.
Very good.
If you're available Friday morning,
Happy Public Health Week.
That's right. Congrats.
Can I digress for just one second?
Of course.
Are you guys familiar with Recovery Connection? Okay. Something like that would be potentially what you could model for the school-based program, where you have somebody that's just a contact where the parent's struggling with a kid, if a teacher's struggling with a kid, where you can just give them somebody that is plugged in that can get them the information that they need. I know the Get Help button's great, but actually having somebody to input that information into, kind of like Mrs. Chevernak has for Recovery Connection.
Yeah.
I think that would be something to model.
Great.
Yeah, and that's something, I mean, Carrie she's gotten a few calls and she actually has been able to connect parents with different things based on what the need is. And what
Exactly.
the questions are and those kinds of things as well, so.
Right. Sorry.
No, that's
Thank
good to know. No, I, thank you.
All right. Any other committee reports? We're all good. So,
Time of the
And in fact,
Susie,
oh,
I
does
did
Susan
want to
have-
let you know that Dr. Stamp said, I love the way that Susie's doing her report. And I said, she asked if anybody knows.
Yes, thank you. The Excel spreadsheet is really nice that way.
how about the asthma grant? Would you?
Oh, my goodness. Thank you.
Okay.
Thank you. So, the state sent out an opportunity. Oh, my goodness. I apologize. For a capacity building grant for local health departments to develop an asthma program.
What is a capacity building grant?
So that's basically, they have money available, and if we wanted to apply for it, which it was a very, very quick turnaround, I think it was like a week.
A week?
Crystal,
Wow.
to build a program. So
Okay.
they would like people to consider having an asthma program. And coincidentally enough, we've actually been talking about it since before HFI.
Yes, you have.
We started talking about it during HFI, and then Dr. Stamp and I were actually talking about it the other day from a journal article that she received. And then I think the next day we got the request for proposal. And so it would kind of run a little bit like our lead program does, to be honest, where there's a nursing and an environmental component.
Okay.
And so if somebody was referred to us through the nurses because they were a patient, through Carrie because they came in through the care coordinator, or through a provider's office, it would be a home assessment component to go into the home
Wow.
and identify asthma triggers, and provide information on how those
Cats and
can be
tobacco.
reduced
Mold.
or even eliminated depending on what they are. And then also education on limiting personal triggers and taking care.
They never get rid of the dog in the house.
Well, they're not the dogs are never the bad
American
guy.
Academy of
They're danders.
Pediatrics.
And the carpets.
Just
My dog.
did-
I could never get.
That's in the carpets. The family
Yes.
member.
Keep them out of
Yes.
Usually, it's not only the
It is-
education component helps so much with asthma and everything.
I know, right?
It's also, they always come in exacerbation because their insurance is not covered their inhalers.
Yep.
Yes.
So would they
For the
have some
spacers.
sort of
Space.
something
There's-
Yes. So what the
that would
capacity
be very helpful?
building grant does is basically allows us to get trained. So there's a state training that's free, but then there's also other trainings that you can choose from, and it's all on the state website. They have a lot of great resources. And I believe the American Lung Association was the one that we proposed, and so it would be training the staff to do their different components of.
I think that's great.
And then also allow us some program supplies.
To that note,
Mostly training, program supplies. Oh, yes, educational materials and printing. And then there are programs for schools too, so we could go in and educate in schools.
I'm sorry to cut you off. I think one of the things that absolutely has to be part of that is supplies for rescue. I think one of the big issues is people having to go to the emergency room because they don't have an albuterol to hit off of. So if we would have some way to be able to give those patients the tools necessary to avoid the emergency room, I think that would be the big win there.
And that is, we would So that actually is not something that can come from the capacity building grant, but that is absolutely something we can build in.
At least for them to know where to try, because I can see that they
Exactly.
prescribe.
To avoid having
Yes,
an emergency
yes, I know.
because you don't have your albuterol.
And the how many times do we educate like maintenance versus rescue?
100%.
I mean, I don't.
Yeah, yeah.
It's probably the thing I say over and over again. After so many years, it still doesn't sink in. You know, so just to have another layer of
Yeah.
education to get to people to
And
know
just
the
a
difference,
resource to not have to go to the emergency room and spend
100%.
$1,000 to get an albuterol treatment.
or nebulizer treatment.
Now, Jess has gathered all of the schools' plans, so they are all to have a plan, gathered all of their plans, and then we're making sure that they have spacers, peak flow meters, and things like that in the schools. And that's something that we had already done before the option for the capacity building grant. And those things actually aren't covered by the grant. And
Not
that
covered
is
by
something
insurance
we're
anymore
already
either.
doing as part of the school
Well, that-
liaison.
They don't reimburse.
Things and albuterol, things like that are things that we can provide as needed from Health First Indiana.
Beautiful.
I think it's great.
Beautiful.
And the state, so each school is supposed to have an asthma, just a general asthma action plan.
Right.
It's ideal, so to have an asthma action plan, of course, and good communication with the primary care doctors, and all that stuff, you know, all these kind of
We filled it.
ideal, right? The ideals for your asthma action plans for individual students. But the things that we see in urgent care very similarly to not having the rescue inhaler, not having a rescue inhaler that isn't expired, forgive the double negative, not, and then always wanting their nebulizer solution when they can be taught how to use a spacer with the same efficacy. So those are things that I felt was very important. The state has now a standing order. So it used to be that each school needed a standing order, a relationship with a physician in order to administer albuterol or other emergency medicines like epinephrine or whatever. The state health commissioner now has a standing order for all of those for the school.
Beautiful.
So we do not have to individually have to do that. I was
Very nice.
I was the physician order. I think I was working with Boone or a couple of the smaller township schools. But that is now a state standing order for those emergency medicines. But the,
I mean, honestly, you can't overdose somebody on albuterol. It's impossible.
right,
Why would
It's
we?
bad.
Why would we? Yeah. A pulmonologist once told me the only way to hurt somebody with albuterol is to drown them in it. I mean, 'cause it can't hurt.
right. The question though, that for the nurse then,
Right.
after they've had 6 or 8 hits of albuterol, do you send them back to gym class?
No.
Right.
You know, where do you go
Yeah.
next in your flow chart? So your guidelines. So that's kind of the
We
important.
did apply for this grant.
We did, and we received, it was a very, very quick turnaround. We
Good.
did receive it, and so we would just need approval to accept the funding.
And what does the fund, you said it doesn't cover supplies, but it covers education?
Correct, it would
Okay.
cover training,
going
educational
in-house.
materials, and there's a program materials,
Remove.
which I assume is
that?
our
How much is in the grant?
So it is for $8,800, just to start the program.
Take it.
It'll be
I
pre-
present a motion to approve the grant funding.
One doctor's visit to your office.
I'll approve.
Yeah, yeah.
mean, you-
Kathy was
Kathy's
second.
It is.
You're popular.
Dr. Boswell,
Yes.
Dr. Brown,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Kathy,
Yes.
Dr. Rosan,
Yes.
Terry,
Yes.
Thank you. I look forward to hearing more about what you
Absolutely.
do.
Receive information today, the regular immunization grant, that's a sub-grant from the CDC through the State Department of Health. We did receive information today that everybody's is being funded at the full amount. So
Oh,
when we get that letter, then of course we will bring that to
good.
the board as well for approval to accept that.
We'll take.
I know. Nice. I did last week have a good report trying to get somebody some counseling. And the reply back was apparently the state had provided the county a grant to enable this scenario, which I apologize, I can't remember, to allow for telehealth visit counseling because they couldn't get there, you know. It was just, you know, just, you only get about one of those a month where something works out or you get this access that you otherwise don't know what to do. But those are things that are starting to happen. So it's because of you guys.
Great.
Very good. All right. Anyone else?
Carrie said it all. I have,
Well, you guys have really,
there's been so much.
so much, yeah,
Behind the,
Amazing.
they've been doing a
amazing.
great job. I don't have any
Super impressive.
It really is.
issues.
It really is.
They're doing awesome. A lot of work.
Thank you.
And not just reaching out in our community, but reaching out to others to investigate and learn.
Yep.
I'm humbled by you. Very good.
I've made so many friends.
Yeah.
And that's, yeah.
Well, and you're very well respected, as we saw.
You know, talk to Noble County. It's just, it's.
Yeah.
I mean, you really are. No.
And
It's.
in medicine and the practice of medicine,
Yeah.
it's not the biggest brain, the best imaging, the best labs. It's the best communication.
Correct.
So it's like that in many things. So what you're doing is you're creating just different groups of people that can guide and help
Network.
assist. Network is the word I was looking for. So thank you.
Thank you. Thank you.
Anyone else
Is there anything else on that report?
that you found
Those
interesting that
two things are.
I think, well, the one was removed. They weren't ready yet, so we'll do it next month. Yeah. Miscellaneous of anyone? All right, then we can move on to public comment. We have no public comment. Usually you join us. It's okay. Well, there's two of you. I mean, we outnumber.
Okay, I do have, I guess, a couple questions. Is this new? Are you a new board member?
No, this is, he's the attorney filling.
Yeah, I'm sorry.
I'm the attorney.
Mr. Hellenbeck is out of the office this week.
Oh, will he be back?
Yeah, next week he'll be back.
Oh, okay.
Yeah, he's filling in.
Just curious.
He's just helping us,
We should have come up with a better story.
I am Dave Hollenbeck.
Hey,
This is what the new health department.
this is what the health department.
your plastic.
A quick question with the vending machine, with the Narcan condoms. What about things like vitamins? Things of that nature. I mean,
Supplements.
just looking at it from a healthier.
Think about prenatals or
We could question.
certainly look
Yeah,
at that.
yeah, not against it.
For the bike program.
Say that again.
For the bike program.
It came from our Healthy First Indiana funding.
Oh, okay. And how much was spent on the bike program?
What is the allotment that we have available? I don't know that we'll spend it.
I can pull it back up. I apologize. I just got that. I want to say it's 50,000.
And that combines the lift.
That's an up to amount.
Yeah.
So it's going to be, that's an up to amount is, I believe we set aside 50,000 for it, but that is, it's going to be accrued as individuals are applying for the bikes. So,
If you guys already had.
I mean, maybe $250 now.
Yeah, just recently, right?
This is one of the
Are you,
needs.
okay, so are you keeping track?
Of course.
Well, you say of course, but when you're reading it, it says you can keep the bike
Well, yes,
as long as necessary.
I do believe they keep the bike.
If I came up and I was like, hey, I need a bike.
Well, then you speak with Ms. Honeycutt over there and she discusses with you your needs.
So you would just give me a bike?
If you meet the requirement.
You know, okay, I'm just curious because, you know, we have.
There was a list up there that had the requirements that was up there that.
We have
that
other
showed.
problems in the community with, you know, the tents being passed out. And I'm just looking and hoping that this is not another avenue that we're wasting resources. The bike seemed like a waste of money, in my humble opinion, I should say.
When you have a car, you don't think,
Oh, I've been without a car. I've been without a car.
well,
We do have the V-Line, am I not correct? And does the Porter County Aging, do they offer transportation to and from?
They do. They're short of supply too. They're actually one of the people that came to us to ask for assistance and money for more vehicles, actually. So transportation is just a huge limit in this area from what we're finding. So we're,
Just in this area, you're saying?
well, we did our need and
Portage or the?
no, the county, the needs assessment that we did with the county, so the entire county. And so it's hard with the funding that we have to, we can't purchase a vehicle, so we have to kind of be able to do what we can do. And so this was a nice introduction to GAP and help with people with transportation.
Thank you.
You're welcome.
Yeah, I had, while you were talking about some of these things, I had an idea about, you worried about the abuse of the vending machines. And I thought, especially, why not place them in the, like the 320 recovery and places that are actually helping these people?
And where did you
More
say?
people may be needing.
The people that work with.
Oh, so actually, I spoke to the person at the Portage Recovery Center about it. I think we have to find a balance of where people don't feel stigma and being around people that they know to use that machine versus, I don't know. So it's going to be interesting to see where they do end up and where people would want to have that be. I think there's the balance between some anonymity and accessibility, yeah. And so I don't think that's a bad idea. And then, yeah, being on the main road so that people can get to it if they need to. So there's a lot of factors. Their bike.
Well, we talked about Portage Recovery.
We did, yeah.
He was very excited to have the vending machine there, but
Yes.
if you have ever been past the Portage Recovery building, it's not easily accessible by foot. It's not a heavily trafficked area. There's
the 320 recovery. I've been aware of those people for a long time. I actually lost a family friend, years ago, who was using their services and unfortunately is deceased. That wasn't. They were successful. He just wasn't.
It happens. But if we have more than two, I think then we can continue to branch out if they show to be successful in the higher population.
Right. And I see, like when Carrie was talking about the bike idea, I thought, oh, that's so great. Oh my gosh. Well, I'm like sort of naive, It's like I'm thinking, everybody's thinking the way I'm thinking, that I wouldn't ask for it unless I needed it. But I think the men who are, questioning this are a little more in touch with reality. And I'll just say real quickly that I met somebody, I took a trip, and my roommate was a woman from New York City. And she was completely clueless that half of the stuff she was telling me about, that she was telling on herself, because she was doing all kind of nefarious stuff. But she didn't see it that way, because it's free, And she was saying that they gave her $250 a month in just things. This isn't medicine, just stuff from the drugstore. Well, she didn't need $250 worth of stuff, but she went and got $250 worth of stuff, and then she would sell it, right? And then they had a situation where they were sending someone in to help her in the home, and she didn't need the person for 5 days, so they cut a deal. And so the woman was supposed to come for 5 days, so what they decided on was she would come for 2 days, and she would give her money back from what she was being paid by the state. So the lady was making $1,000 a month because the other women could pick up a job somewhere else. So I'm just saying, these things go on.
Sure, there's a lot of things that go on, absolutely. But we're here to help people who need help, and that's where Carrie's going to work with people to see who needs it.
Right.
But there's always bad stories. There's always.
I think Porter County is a different animal somewhat, so hopefully.
People that don't want to help themselves.
Yeah. Well, I like the idea personally.
It's a safety concern.
Yeah.
I mean, we keep giving all these resources to help the people. What are we doing this for?
I'm always going to choose to help the people.
Oh, I did have one other idea. Okay. I did have one other idea. I have a friend who.
We're out of time, Penny.
I know.
Sorry.
This is.
They're all giving me dirty looks.
This,
like.
gosh, the idea of getting people picked up, okay? I have a friend who's a Christian, and she's actually a professor at VU.
Well, send us your suggestion, please. We had our
Well, just please.
had our time
Okay,
limit.
they were helping all these people that didn't have rides by having a network of, it's something, the Christians would be doing it. They would be volunteering.
They may. No one's stopping them.
I'm wondering if we couldn't coordinate some of that in with our problem. Okay.
I think those exist.
Coordinating with all kind of other people, why not
Yes.
the church?
For us, yeah.
Exists.
No, seriously.
I think that's great.
Okay, all right, thanks.
Thank you.
Thank you.
All right, emotion.
So may I make a
Yeah.
quick comment? Penny, I think the idea of having a volunteer service is really amazing. I think, in fact, I believe there's something like that. Doesn't Hebron have something, a transportation service? I don't want to misspeak, but working with volunteers can be great. It can be chaotic. Because if you're not paying somebody to do a service, you don't always get the same level of commitment, right, that you do if somebody's expecting to be paid for it is that's very true.
We can have all of it.
It is something to think about. As far as the bikes go, I have a couple thoughts. And we have really thought about this pretty well too. So if you saw, Carrie had the actual application for the bike up here. It's available on our website. It's pretty involved. It's not like I'm Miss Miller and here I'd like a bike here. So there is a significant application involved. You actually have to talk to Carrie. She is interacting and discussing like, hey, where else do you need help? We understand that there will be people that will be there like, oh yeah, I am so there. And then that bike is going to end up at the pawn shop, right? So that's the thing that I didn't want to have happen. I'm like, how do we keep these bikes out of the pawn shops? And how do we help the pawn shops understand what this program is so they get the bikes back to us, right? Or that they don't just end up in a tree somewhere after someone, falls down, drunk home or whatever. And, things happen, right? We've been to college, a lot of us. So things happen. But so we were talking a little bit earlier about the tagging system. Each bike is going to have a serial number attached to it, specifically on a bike tag, not in a particularly conspicuous location, but enough so that this bike belonged to this person and ended up at this pawn shop. And then we know that's a person our services aren't helping, right? So we're really trying to keep track of who's getting the bikes without being too invasive into their privacy, but how can we help them, right? What other ways can we help, and how can we protect the assets that we're distributing to? We're trying to be good about
I
that.
think the bigger issue that kind of the thought process is, we live in Northwest Indiana. I mean, how many usable days are there a year where you're actually going to ride a bike somewhere, essentially? And the vast majority of the citizens in this county are, for the most part, rural. I mean, yeah, we do have a couple population centers, but for the vast majority, you're not going to be able to get to work. I mean, even I, that lives 5 minutes away from work, I couldn't ride a bike to work if I wanted to. So the idea is, how much is this actually really going to solve any problems? And that's really, I think, the gist of it. So I mean, trying it out, it's noble, and I'm not saying that we shouldn't try, but I'm just skeptical as to how much of the problem is it really going to solve.
Yeah, absolutely. And as we have this transportation problem that everybody in our community needs assessment said over and over again.
Absolutely.
And so we are working on trying to address it in a number of different ways the best we can. And we are keeping track. The IDOH is going to be getting the information. You will all be getting the information as to how many bikes we use, and maybe we'll hear from some people who received bikes and maybe we'll hear good things and maybe they'll all just end up at the pawn shop. And in which case, we have our answer and we change directions. None of this is a 20-year commitment.
No.
And none of this is a projection to expand huge amounts. We aren't going to be spending necessarily $100,000 next year, because I don't even think we'll be.
And part of this
Or what?
the LIFT program
Yeah.
too.
Well,
So-
and I think that's where the bang for the buck is.
Yeah.
That's where I mean, look, as a physician, I can't tell you how many times I have elderly patients, I have patients that are indigent that cannot get to the doctor's appointment.
Yeah,
Nobody to
same,
take them.
yeah.
I mean, that's where the bang for the buck is, and getting people a ride somewhere especially in our rural county. So, but anyhow, I've said my piece.
Thank you.
myself.
Yeah, no, we are
It's a work in progress.
going to pivot when
But
we need to.
And we didn't want to not, when that comes up as the number one need,
100%.
we have to think outside of the box.
Yeah.
Through your insurance, you get medical transportation.
Yeah, but I'm
Oh,
gonna tell you.
not everybody does.
Yeah, I'm going to tell you from our side, and I'm going to getting that approved, getting it set up, getting the actual ride, getting the patient to the appointment on time. It's a nightmare.
It's
An absolute.
it's rainbows and unicorns.
And when you're the person.
Bikes going to,
I didn't say the bikes. I'm talking about the Lyft program and being able to call an at-will person to come to a patient's house and pick them up and bring them on time to an appointment and have that availability outside of having to deal with insurance. I have one person in my office who literally sits on the phone all day long with insurance companies trying to get things approved. And I pay an employee to do that. If I had to pay an employee to sit there as well to get my patients rides, like it would bring my practice to a screeching halt. I couldn't see patients. So having some sort of resource to get patients into the office that otherwise don't have that ability is gold. And I can't stress that.
And I think for young people, so many of our young, teenagers, young adults
Right.
who can't afford car insurance, who want to work, who can't afford a vehicle, like this is a nice avenue for that age
I
group
agree with
who the workforce is limited. We need those people. And so I think it's a perfect
I
opportunity.
think one of the reasons why transportation is at the top of the.
It's expensive.
But, well, no, it's expensive, but it's also because we're so rural. And I think that's one of the reasons why the bike objection is huge, because we have a rural community.
But Portage and Valpo and Chesterton, I mean, you
Yeah.
see people on bikes
I
mean,
nonstop.
Usually it's related to those in their late 20s, 30s, 40s.
Right.
That have issues with drug abuse, alcohol.
Right, absolutely.
Lose their license and they use that to maintain.
But I mean, even somebody that lives downtown to get to my office, like if somebody lives downtown that's indigent to get to my office over on 549, they ain't taking a bike to get to.
I have
It's just
people
not happening.
come to me on a bike.
Well, fair enough, but I mean, if you show me the numbers of how many people show up at your office versus how many people drive to your office,
Well, of course.
I will eat my shorts. if
No, it's not.
you Show me how many people
Well, now
up to your
right.
office on a bike versus a car.
No, it's not equal. It's not equal, but I want to try.
Track of it. Please. I want you to do that study for me, Dr. Box.
Yeah, I don't see the waiting area, but I know that they do. And I know that, and I've gone to the host events, and people show up there on bikes,
Yeah, that's,
white, in the winter.
My office is in the middle of a cornfield on 549. We don't even have a bike rack.
I look at it not so,
Maybe that's an area of,
Yeah.
of improvement and
We should get
a suggestion for,
I don't see it as necessary
bike.
getting to the doctor, or getting to a program,
Or in a
or
job.
work, or
Job,
but
yeah.
usually mine, getting to an event or their work, that's usually,
It does start at
and it's usually about 6 months.
Yeah.
So they can manage their social, whether it's my 18-year-old, that parent, he's out of the house, so he uses that to get to school.
Right.
Uses that to get to his work, because
Yeah.
after school. So, when you do get outside
Yeah.
into these areas, I'll still look forward to an eating the shorts.
That was a Bart Simpson reference, Anna.
50. The idea was, I mean,
Yeah.
my kids do have a lot of friends that do have to ride their bikes to work. They do.
Absolutely.
They
So
do
do
it
mine.
year-round as much as, and so it's, the starting at 15 is so that, they're, and as a matter of fact,
Yeah.
applicants, and it's kiddos who have to work to
Yes.
their family.
Absolutely.
And then also for their activities. So that's important as well, for keeping that attendance up, for keeping those
Right.
kids engaged,
Or in
doing positive things
Right.
instead of negative things. So it's for that as well. So
Well,
If the metrics are there.
Yeah, we'll
and the
find-
program
We'll find out.
shows the Metrics, absolutely, no questions asked. No
But that's
questions asked.
the best part about all this, is we will follow and
Right.
pivot,
Right.
adjust,
Absolutely.
or as Terry said, change gears.
Right. I think the purpose of the board is just to make sure we're not throwing money out the window blindly.
Of course, and it
Yeah.
is.
And to
Exactly.
listen,
And honestly, the loaner program was where, we started. The problem with that are there are barriers to it because you have to have some way they're locked up, right? So somebody has to have an app.
Yeah.
That's a barrier.
Right.
Somebody has to come in and
I
check
know.
an app. That's a barrier. Credit card's a barrier. But then also there's the liability side, and that's where a lot of the things are going to come in. So then there's, okay, you're providing them this bike to rent. What if they get hurt? By doing it this way, we can have that liability release, and we can educate.
The cost might be
know
less
that that's all
overall.
there. So that's why we went this route, and just like you said, this is not, everything about this year is planning and trying, and we have to
Trying
reassess.
things.
If it doesn't work,
or even
Done.
we have to.
Gather data,
Metric.
modify, adapt.
Metric.
Gather data, modify.
I'm an Uber
two
guy.
people.
I
It
don't
was
know.
an Uber actually that picked them up, but I kind of talked to the two people in the front.
Uh-huh.
Because you're, okay, who am I putting this guy in a car with? So there's always gonna be those variables, but, yeah.
And there are a lot of even in setting up our Lyft
Well-
program, if somebody needs help getting
Yeah.
from their house, that's not something that rideshare will do either. And they also will deliver food. And so then we're all,
And that's where the
so it's rough. I mean, there are.
that's where the money is. The money is getting people rides places. I agree with that completely.
Well, we'll find out.
Anyhow,
Thank you.
thank you. I call for adjournment.
Motion.
A motion.
I second. I second. All in favor?
Aye.
Awesome. Thank you. Hopefully we'll, well, I don't know. Hopefully we'll see you next month. I don't know.